Nursing homes and senior care centers across the country have made the headlines because of coronavirus outbreaks. So we wanted to talk with someone about how these facilities are keeping their residents safe.
So we're joined today by Lina Dugan. She's the director of Comfort Care Home of Kansas City. They don't have any COVID-19 cases in their building, which is good news. Linda, thank you so much for joining us this morning. We really appreciate your time. This has been in the news, obviously, the last couple of weeks a lot because of these senior care centers and some of the problems that you're experiencing. As we just said, you're not facing that specifically right now, but how much of a concern is it, not just for you, but for families who have people that are staying in these homes?
Well, it's first of all, thanks for having me. It's been a difficult time for our industry. I actually operate Home Pluses, and we have individual houses that are converted to take care of memory care residents, and it's been a challenge. So as of March 11th, we asked for no visitors, and all of our families were very compliant and totally understood because of the vulnerability of our residents. We did have to make changes immediately where we were temping all of our staff before they entered. We always do good hand washing anyway, but the challenge for memory care residents is they don't understand that distancing or trying to stay in your room or things like that. So we face those challenges every day, but everybody's been on board. The staff's been excellent, and the families have been very understanding. So.
I gotta think that milestones we've seen, anniversaries, birthdays, Easter, passing by during this time is just another step in difficulty. And we're just a few days away from Mother's Day. What are you guys doing to try to connect residents and their families and keep them safe at the same time?
Well, we've kind of started that from the very beginning, even with, like you said, Easter and those things. So families have been really good about sending flowers and sending gifts and cards and notes, and not just to the residents, but for the staff to help uplift the staff and things. So for Mother's Day, we were hoping to do a parade in front of our homes with the families because Johnson County is still in a stay-at-home order. So that doesn't lift until May 10th. So we're going to push back our Mother's Day parade until the following weekend, and all the families are on board. And since we're in subdivisions, we're inviting the neighborhood kids and things like that as well. So we've all worked together. The families are very involved in the care with the residents. We call the families and FaceTime and do Google Duo with the staff, helping the residents do some FaceTime. And if you've never done Snapchat with somebody over 70 years old, you really need to do it because they have a great time with it.
Linda, I was going to ask, I've had family that have been in a long-term care facility like that and in a situation with Alzheimer's and dementia. So much of that is partnering with the staff and the family to help these people. I don't want to call it a burden on the staff, but when the family can't come, that's a lot more work that your staff is having to do in some of these cases.
Well, it is, but once the family members move their loved one in with us, we take over that care concept anyway, and they return back to being the spouse or the child. So we're on board with that. And because we're such a small company and we have consistent staffing, they kind of become the family anyway. Yeah. So they really do. They have all of our cell phone numbers. The families do. It's worked out really well. It's very hard on everyone, but we know the risks that we take and the importance of keeping these elderly safe. We all wear masks. I had a lot of friends that immediately stepped up and made masks for all my staff, and it's just kind of been a whole team effort. So we've shed some tears, but a lot of laughs too.
Well, some really incredible and important work being done.
Thank you so much.
Linda, thank you very much for joining us.
Absolutely. And on this Nurses Day, by the way, please pass along a thank you from us to your staff as well. Thank you very much.
Oh, I sure will. Thank you so much.